Today's interesting topic is Rectus Capitis Posterior Minor. It is one of the muscle of the neck. Where is that muscle? Rectus Capitis Posterior Minor. Welcome to my channel Logic Medico. Logic Medico. If you are new to my channel, consider subscribing and don't forget to press the bell button to get the latest notification of the videos. Without much delay, Rectus Capitis Posterior Minor. What is the location of this muscle and what is the meaning of this muscle? The location of this muscle is on the posterior surface of the neck. So it is present in one of the triangle called suboccipital triangle. Rectus means straight. Okay, this muscle is here. It is straight. So it is going to the skull cap. So it's called capitis. Rectus means straight. It's going to the skull cap, occipital bone. It's called capitis. It is going from behind, right? So it's called posterior. There are two muscles which are going in similar direction. So one is bigger and it's called major. The other one is tinier and that is today's topic, and that's called minor. So a straight muscle going on the back of the neck towards the skull cap, and it is a tinier muscle. So it's called Rectus Capitis Posterior Minor. That's the meaning of this muscle. So in the muscle of the suboccipital triangle, triangle will have three boundaries: the medial boundary, the superolateral, and the inferolateral boundary. This is the midline. Okay. So in the medial boundary, there are two muscles which are going straight. One is Rectus Capitis Posterior Major. The other one is Rectus Capitis Posterior Minor. Whereas in the superolateral boundary, it's Obliquus Capitis Superioris, or just called as superior oblique. In the inferolateral, it is Obliquus Capitis Inferioris, or just called inferior oblique. So out of this, today's topic is Rectus Capitis Posterior Minor. What is the origin of this muscle? So here, landmark I will tell you, this is the atlas vertebra or the first cervical vertebra. This is the axis vertebra or the second cervical vertebra. Okay, so here is a muscle which is very large. Okay, it's large and it's going for a longer distance. So this is Rectus Capitis Posterior Major. It will come from which bone? It's large. Okay, so it comes from axis or the second cervical vertebra. Here is a tinier muscle, minor. Tinier muscle, minor. So it should come from, it travels a short distance, so it should come from first cervical vertebra. So if you have guessed, it's coming from the posterior tubercle of the atlas or the first cervical vertebra, then you have told the correct answer. Then it goes straight upwards to this bone called occipital bone, right? So that is an insertion. So where exactly in the occipital bone? Is it above the superior nuchal line, in between the superior and inferior nuchal line, or below the inferior nuchal line? So it is going to the occipital bone, the medial part of the occipital bone, below the inferior nuchal line. Okay, so that is an insertion. Origin, spine of, there is no spine for atlas, sorry, posterior tubercle of atlas, insertion, occipital bone below the inferior nuchal line. Come to the action. It is mainly a postural muscle. It helps in maintenance of posture, but when this contracts, what can happen? The skull can come towards the atlas, or the atlas can go towards the skull. The skull will go towards the atlas. In such a manner, there is extension of the neck, meaning if you are lifting your chin up, your neck is bending backwards. That is called as extension of the neck. Okay, so it mainly maintains the posture of the head. Also it helps in extension of the head over the atlas. That is an action, because the muscle acts from here, it pulls the skull backwards. Okay, now supply. All the muscles of the suboccipital triangle are supplied by one nerve which is there in the triangle, so therefore we call it as suboccipital nerve. So these nerves are coming from spinal cord. Spinal cord is from the level of cervical to the level of tail, coccygeal level. So which spinal nerve? It is the first cervical spinal nerve, dorsal rami of first cervical spinal. That is the nerve supply of this. This is the nerve I am talking of. See, it's going here and supplying this muscle, Rectus Capitis Posterior Minor. So summary of this muscle, Rectus Capitis Posterior Minor, location on the posterior surface of the neck. It is a straight muscle going on the back of the neck towards the skull cap, and it is a tiny muscle. That's the meaning. Origin, the posterior tubercle of atlas. Insertion, occipital bone below the inferior nuchal line. Action, extension of the head over the atlas. In such a way the chin is lifted upwards. Also maintains the posture, erect posture of human, so that we can see straight. Otherwise we'll be like zombies. Okay, now supply. Now coming from this triangle is called suboccipital triangle, suboccipital nerve because it is there in the triangle. It is nothing but dorsal rami of C1 nerve. Okay, I hope you got this muscle. Like and share this video with your family and friends. Don't forget to press the thumbs up button. Subscribe to my channel, consider subscribing and press the bell button to get the latest notification of the video. Thanks for watching the Logic Medico once again.